Hello everyone. Today in this session we will discuss about the NEET PG 2025 recall questions. So approximately 20 to 21 questions they were asked from the subject pharmacology. So most of the questions are PYQ, that is previous year questions, and PYT, that is previous year topics. So the first question, a 55-year-old man is undergoing general anesthesia for some abdominal surgery. Okay. Shortly after administration of a non-depolarizing neuromuscular blocker, he develops bronchospasm, hypotension and flushing. Okay. So which of the following skeletal muscle relaxants responsible for this condition? Option number 1, atracurium. Option number 2, cisatracurium. Option number 3, pancuronium. 4, vicuronium. These are the 4 options given for this condition. So here we have to identify the key features from this question like bronchospasm, hypotension and flushing after administration of the non-depolarizing neuromuscular blocker, which relaxes the skeletal muscle, which is helpful for intubation, because here the patient undergoing general anesthesia for abdominal surgery. Okay, so this key feature shows that there is probably the skeletal muscle relaxant which releases the histamine, okay, that is responsible for this bronchospasm by causing bronchoconstriction. Okay, this histamine acts on H1 receptor and produces bronchoconstriction and produces vasodilatation. That's why there is a hypotension and flushing. So among the option atracurium and cisatracurium, these two drugs undergoes Hoffmann elimination. Okay, spontaneous molecular rearrangement without the help of enzyme. These two drug undergoes, that is Hoffmann elimination. But among these two, what is the major difference between atracurium and cisatracurium is atracurium, it releases the histamine. Cisatracurium, it does not releases the histamine. So atracurium is responsible for all these symptoms like bronchospasm, hypotension and flushing. So answer is atracurium. Okay. So one more thing we have to remember is maximum histamine release occurs with D-tubocurarine. Okay, maximum. So D-tubocurarine, maximum histamine release, more than that succinylcholine, and this succinylcholine is more than that mivacurium, and mivacurium releases histamine that is more than atracurium. So maximum histamine release occurs with D-tubocurarine. Okay, and atracurium also releases histamine and it causes all these symptoms in that patient. So answer is atracurium. Okay, and coming to the second question, which is related to pheochromocytoma. In a patient with pheochromocytoma scheduled for surgical resection, okay, which of the following is the most appropriate drug for pre-operative blood pressure control? So this is also previous question and as well as previous year topic. And the option is pinoxybenzamine, clonidine, difedipine and esmolol. So you already know that. So pinoxybenzamine is the alpha blocker, irreversible. It is the preferred drug or most appropriate drug for controlling blood pressures before surgical removal. Okay. So here we will use both alpha blocker and beta blocker. First we have to use the alpha blocker. What is the reason? Because you know that this pheochromocytoma, it is due to excessive catecholamine secretion takes place from the adrenal medulla. Okay, so here what happens, because of these excessive catecholamines, okay, there is a vasoconstriction occurs. The patient experiences fluctuating hypertension. Okay, so excessive catecholamine secretion from the adrenal medulla. Here this pinoxybenzamine helpful for what? Equal distribution of body water and blood volume. Because of vasoconstriction, blood volume is very less and most of the excess catecholamine secretion are deposited in the tissues. And this phenoxybenzamine is a venodilator and it is responsible for equal distribution of body water as well as blood volume. This is the alpha blocker. During surgical removal, when there is a removal of surgery, that is gland, okay, so that time more amount of excessive catecholamines enter into the blood and produce a sudden increase in the BP. That's why we should give this alpha blocker called phenoxybenzamine 1 to 2 weeks before surgery, and during surgery we have to administer this phenoxybenzamine intravenously, because during surgical removal pouring of excess catecholamines into the blood, okay, and it produces sudden increase in the blood pressure. Okay, if phenoxybenzamine is not available, we go for pentolamine, that is administered during surgery intravenously. So the preferred drug is phenoxybenzamine. Okay, but beta blocker also given after alpha blocker. This beta blocker is given to treat tachycardia and arrhythmias. Okay, so beta blockers are given in pheochromocytoma to treat the symptoms like tachycardia and arrhythmias. So, but beta blocker should never be given, okay, first. Okay, when we give alpha blocker, then only we have to give the beta blocker. Otherwise, sudden increase in the blood pressure occurs with these beta blockers. If you administer beta blocker first, there is a chance of sudden increase in the blood pressure. That's why alpha blocker we have to give first, followed by beta blocker. This is also most possible expected question in the future examination. Okay, in case of pheochromocytoma, we have to apply alpha blocker followed by beta, or beta followed by alpha, or both at a time, or none of them. Like this, there is a chance to ask the question in the future. So there are two questions we discussed from the NEET PG 2025 recall. So these are the expected and also previous year questions and topics. From there they arise with these questions. Okay, thank you all.